Doctor, how do you optimize implant positioning?
So this is another lecture slide by itself. Okay, so in general, when it comes to implant positioning, we have to talk about four main aspects. Alright, firstly would be the mesial-distal. Alright, so it's like you are doing normal crown. You have to make sure the mesial-distal preparation is done perfectly. It should be symmetry and everything. The same for your dental implant. So it's actually limited by how much space that you have between the mesial-distal with the negative. Okay, the distance. Alright, so we look into that. Ideally, the distance between the natural tooth and implant should be 1.5 mm. Between implant and implant, it should be 3 mm. So if you are placing two implants side by side, it should be 3 mm. Between implant and the tooth should be minimum 1.5 mm. Yeah. So this would be for first mesial-distal distance. Alright. Secondly, when we talk about apical-coronal position, which is crown height, so ideally we should have about 9 mm if possible for optimum. If we have anything shorter than that, there might have a chances that your crown might dislodge. Okay, so we also have to be careful about that. That's why I show you the cases just now, that we actually have to increase the vertical dimension so that we can have a proper apical coronal distance to proper optimum crown height.
Doctor, this is even more significant when it comes to posterior molar region, right?
Yes, yeah.
Where the maxillary sinus is located there.
Yes, that's right. Yeah. Okay. So thirdly would be labial-palatal position or buccal-palatal position. Okay, or also known as bone width. I actually prepared two images for this. Okay, so as you can see from the image, if you are going to place a dental implant of 4 mm, for instance, ideally your buccal region should have about 2 mm bone surrounding your implant. Bone is 2 mm buccal, implant is 4 mm, and lingual we should have about 1 mm. So the total should be 2 plus 4 plus 1 should be about 7. So if you are going to place a dental implant, buccal-palatal distance should be about 7 mm. If you have less than that, it means that you're required to do bone graft. Yeah. So this is about mathematics. Yeah, it's actually quite easy, right? Okay. Last but not least, look at the implant angulation so that we will have maximum intercuspation for proper occlusion. So these are the 4 things that we have to look into. It would be mesial-distal, the crown height, apical coronal, buccal-palatal, as well as the implant angulation. So it's combination of everything to obtain the optimum implant position.